All right, let's talk about something that so many of us have dealt with, a skin rash that just hangs around. It's itchy, it's annoying, and today we're going to get to the bottom of what your skin might be trying to tell you. So, have you ever had one of those? An itchy, scaly patch of skin that seems to have a mind of its own? Well, you are definitely not alone. And the culprit? It might just be a super common fungus. These kinds of fungal infections are incredibly common. I mean, most of us will get one at some point, and they're caused by fungi that we can basically split into two major groups, and each one plays by a totally different set of rules. Okay, so think of it like this. There are two fungal teams. Team 1, you've got the invaders. These are called dermatophytes, and they literally eat the dead keratin in our skin, our hair, and our nails to survive. Then you've got Team 2, the opportunists. These are yeasts like Candida and Malassezia. Now, they're actually normal residents on our skin, but if you give them an opening, they can multiply like crazy and cause a real problem. Understanding this difference is absolutely key. So let's dive into Team 1, the dermatophytes. You've almost certainly heard of them by their more common name, ringworm or tinea. And let's just get this out of the way. No, there are no actual worms involved. Tinea is just the technical name for these infections, and we label them based on where they show up on the body. So let's meet the family. When you get ringworm on your body, your trunk, or your limbs, that's Tinea corporis. And it often makes that classic round patch with a clearing middle. Down in the groin area, you get Tinea cruris, better known as jock itch, which usually looks like a big, symmetrical patch. And up on the scalp, Tinea capitis can cause scaly patches and even hair loss, sometimes leaving these little black dots where the hair has broken right off. Okay, this right here, this is the picture you probably have in your head when you think of ringworm. That clearing in the center is the hallmark sign. It's basically the fungus expanding outward in a circle, and the skin in the middle starts to heal as the fungus moves on. Now, sometimes, especially with a scalp infection, the body's immune response goes into overdrive. This can cause something called a carian, which is this boggy, swollen, inflamed mass. It's a really serious complication, and it's a huge red flag that you need to see a doctor because it can lead to permanent scarring and hair loss. All right, let's switch gears and talk about our second fungal team. Their whole strategy is different. See, unlike those dermatophyte invaders, these infections are caused by a yeast that is already living on our skin as part of its normal microbiome. The issue isn't that the yeast is there, it's that it's suddenly having a massive population boom. A perfect example of this is pityriasis versicolor. It's caused by a yeast called Malassezia. It pops up as these little spots, usually on the back, chest, or upper arms. And here's the dead giveaway. The skin in those spots won't tan. So after you've been in the sun, the spots become way more noticeable. The good news? It's not contagious at all. But here's the kicker. Because that yeast is a normal part of your skin, this condition loves to come back. I mean, the recurrence rate can be as high as 80% within just 2 years. That's huge. And it's exactly why long-term preventative treatment is often part of the game plan. And then there's the other big yeast player, Candida. This causes cutaneous candidiasis, and it absolutely thrives in warm, moist places like skin folds. The rash itself often looks beefy red with these weird, irregular edges. But the real telltale sign, the thing that really distinguishes it, are these little satellite lesions that pop up just outside the main rash. So these are what we're talking about. Satellite lesions. They are the calling card of a Candida yeast infection. If you see a primary rash in a skin fold, but then you see these little outposts scattered around it, you can be pretty darn sure you're dealing with candidiasis and not ringworm. Okay, we've identified the players, we know their strategies, so what in the world do you do about it? Let's get into a solid action plan, starting with the basics, prevention and everyday care. If there's one thing to remember, it's that all fungi love warm, moist environments. So your number one defense is keeping your skin clean and, more importantly, dry. Here's a pro tip. Use a hairdryer on the cool setting to get those skin folds totally dry. And of course, loose, breathable clothes make a huge difference. And to stop the spread of those dermatophytes, just don't share things like towels and clothes. Now, when you get to treatments, you absolutely have to know which fungal team you're fighting, because it is not a one-size-fits-all situation. Some creams work on both, but some are super specific. Nystatin, for instance, is a champion against Candida yeast, but does nothing for ringworm. And that really common antifungal, tolnaftate, it's completely useless against yeast. This is exactly why figuring out the culprit is so important before you buy anything. Okay, listen up, because this might be the most critical piece of advice. You might start feeling better in just a couple of days, but that doesn't mean the fungus is gone. If you stop treatment early, I can almost guarantee that infection is coming right back. You have got to finish the entire course of treatment. No exceptions. Treating a simple case yourself is one thing, but there are definitely times when you need to call in a professional. It's so important to know when it's time to stop guessing and go see a doctor. So here is your checklist. You need to see a doctor if that infection is anywhere in your hair, scalp, or beard, or on the palm of your hand. You also need to go if you have a compromised immune system, if the creams you're using just aren't cutting it, or if you see any signs that a bacterial infection has set in, like extra pain, swelling, or drainage. Don't wait on these. And here's the simple reason why. Creams and lotions, they just can't get deep enough into a hair follicle or through the super thick skin on your palm to actually kill the fungus. For those areas, you're almost certainly going to need an oral medication, something systemic, prescribed by a doctor to truly get rid of it. So the next time you're dealing with a rash that won't quit, remember to be a detective. Look closer. Is it a ring with a clearing center, or is it a red patch with those little satellite lesions? Paying attention to these small details, that's not just for curiosity's sake. It's the key to finally understanding what your skin is telling you and ultimately finding the right solution to get some relief.